I'm Dr. Joshua Huffman, the owner of Mounds View Chiropractic and the author of this book, Growing Young. This is a book that covers natural alternatives to a wide array of health conditions. You're watching this video today because someone you love is struggling with ADHD and ADD. You certainly may be asking yourself, what makes this doctor different from any of the other doctors that we've seen? It certainly is a fair question, and it's one that I get asked a lot. You see, I'm a board-eligible chiropractic neurologist with advanced training in functional blood chemistry analysis. My practice is focused on treating adults and children who suffer from chronic neurologic conditions such as autism, dyslexia, ADHD, migraines, neuropathy, and really many other disorders. Most of my patients, by the time that they arrive at my office, have been to multiple specialists and have tried multiple different forms of treatment, oftentimes, unfortunately, with very little to no success. What makes my recovery program for kids with ADHD and ADD so effective and so unique is that we treat your child both metabolically and neurologically. This unique approach is what I'm going to be spending my time explaining to you on this video today. I actually consult with hundreds of doctors across the country on the very treatment that we use in our office for the treatment of these attention deficit disorders. Now, before we get started, I just want to personally assure you that in my office, no stone is left unturned to determine the exact cause of your child's ADHD or ADD. So please listen close to this video because I guarantee I'm going to be sharing life-changing information with you. Now, I'm beginning to discuss ADHD and ADD. I want to share what I find to be some truly staggering statistics. Attention deficit hyperactivity disorder, which is also known as ADHD, and then attention deficit disorder, which is known as ADD, affects approximately 6% of our population, with less than 2% of these kids being treated. Out of 100 people with ADHD, 35 of them won't finish high school. 25 will repeat at least one grade. 52 are abusing drugs or alcohol. 40 out of 100 have tried alcohol and tobacco at an early age. 19 are smoking cigarettes. So 19% are smoking cigarettes compared to the national average of 10%. 75% have interpersonal problems. 20 out of 100 have set fires. 30 out of 100 have engaged in theft. 25 out of 100 will be expelled from school for misconduct. Numerous studies show that approximately 50% of inmates have been found to have ADHD. People with ADHD have a higher percentage of motor vehicle accidents, speeding tickets, citations, suspended and revoked licenses, and medical visits. Parents of ADHD children, divorce 3 times more often than the general population. I will guarantee you that no one has told you what I'm going to share with you today regarding ADHD and ADD. I'm going to be addressing, number 1, what makes my program unique, and number 2, how I successfully manage these patients that have ADHD and ADD. So let's get started with what makes my program unique. First of all, we evaluate both sides of the brain and provide treatment to return proper brain balance to the two sides. So let's talk about the two different sides of the brain. In order to really fully understand what's going on with ADHD and ADD children, we must look at them in terms of brain hemispheres, or you have this right brain and then this left brain. When we understand what each side does normally for a kid who doesn't have an imbalance, then we can understand what goes wrong when there is this imbalance in function. This is what we call a functional disconnection. So it's important to understand what each hemisphere does. The right hemisphere is your brake pedal. Okay, it's responsible for your withdrawal responses. It's going to stop movement, stop thought processes. It controls your gross motor function, your posture, and your big movements. It likes low frequency stimulation. It's really the where part of the brain. It also is involved in your social learning, how to apply knowledge and how to behave socially appropriately. It's responsible for your nonlinear creative thinking, It's responsible for your nonverbal communication, your face, your eyes. If you smile, you can realize that somebody's happy. It's responsible for your reading comprehension. Okay, the left side of the brain is really your gas pedal. Okay, it controls your fine movements, your small movements, the fingers. It likes high frequency stimulation, such as TV, computers. The what part of the brain it would be considered. It's responsible in your memorization of your facts, your linear thinking, your verbal fluency. It likes routines and the sameness. It's also considered the happy part of your brain. So when you have a brain that's out of balance because of a right brain deficiency, which most of these kids have, they love TV, they love videos, they like routine, they often have great memory, but they often have above average intelligence. But they have poor social skills and poor verbal skills. They may throw tantrums. They have poor emotional control. They're very self-directed. They're not very passive. They have a tendency to fidget and just constantly move. They have a tendency to fixate and stop thinking and just continue to dwell on one thing. They often have sensory issues. Now, why do these kids develop language delays? Well, the right hemisphere is responsible for your nonverbal communication. Nonverbal communication is really the foundation of verbal communication. So when they have a right brain deficit, they don't have that foundation to build on. They have a hard time understanding one's feelings. They have a hard time understanding facial expressions, body language, and making that appropriate. Without these basic pillars of communication, appropriate verbal communication becomes delayed. One method to encourage appropriate speaking in these children is to work on building the foundation, the nonverbal communication, stimulating that right brain. Why do they develop sensory problems? Well, sensory problems most often are not a problem with the particular sense. It's often that the problems with, they are often problems with frontal lobe function and an inappropriate withdrawal response to normal sensations. Traditional treatment options for these brain imbalances that we're talking about are usually medications. These traditional treatments, such as medications, don't take into account the difference of the hemispheric imbalances. It's going to treat both sides, which is not in the best interest of your child. Which side, we need to know which side of the brain needs more help. Is it the right side or the left side? What specific areas of the brain have become underperforming? Is it the parietal lobe, the temporal lobe, the frontal lobe, the cerebellum? Okay? And are we exceeding metabolic capacity? When is enough too much? There are certain areas that can't tolerate as much stimulation, and we need to know that, and we need to measure that. So how do I successfully manage these patients that have ADHD and ADD? Well, like I said before, we're going to use both specific metabolic and neurologic testing and then appropriate treatments. What I want to go over now is what metabolic testing it is that we perform. Number one, we're going to run sensitivity testing, allergy testing. We want to determine if your child has a sensitivity to gluten, which includes wheat, rye, oats, and barley. We want to see if they have a sensitivity to milk, eggs, yeast, soy. Any of these food sensitivities could be making your child's ADHD worse because it promotes inflammation in their brain and really throughout their body. Some of the common symptoms of these IgG food allergies are chronic pain and fatigue. They may have frequent indigestion. They may have a feeling of being bloated after eating. They may have frequent loose bowel movements. They may suffer from constipation. You may notice that they get mouth ulcers and sores. The only way to find out if your child is suffering from these IgG food responses or food allergies is to simply run the test. We also use complete blood panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC with differential, we can assess your child's thyroid glands, your adrenal glands, the liver, the kidneys, the red and white blood cells, and also the gut function. Okay, all of these can be affected with chronic health disorders, including ADHD and ADD. By addressing any of these problems with your child's thyroid, the adrenal glands, the blood chemistry, or the gut function, we help them to heal faster. The complete metabolic panel also allows us to check your child's blood glucose levels, which is very, very important since glucose and oxygen are needed by the brain to function properly.